There is no confirmation that the shooter at Sandy Hook Elementary School had a mental illness, but the tragedy in Connecticut has once again sparked a discussion about diagnosis, treatment, and services for the mentally ill. Joining me to talk about mental health laws and programs in San Diego are my guests, Piedad Garcia with San Diego County Behavioral Health and Dr. Michael Plopper, Chief Medical Officer of Sharp Behavioral Health Services. Thank you both for joining me. Dr. Plopper, 10 years ago, California passed Laura's Law for people with mental illness, I believe, who are in danger of hurting themselves or others. What is that law?
Well, this was a law that was passed, as you mentioned, in the state of California in the early 2000s, which the purpose was to provide for assisted outpatient treatment for people with serious mental illness who have been demonstrated to have issues with noncompliance with treatment and have had a potential for harm to self or others. It can be implemented in each of the counties in California, so each county has the choice of implementing this law or not.
Only 2 counties have done so. San Diego is not one, and we'll get to that in just a moment. But how is this Laura's Law different than, let's say, the 72-hour hold, which is available right now?
A 72-hour hold is implemented in a psychiatric facility, or a person can be taken by the police to initiate a 72-hour hold in a psychiatric facility. The difference is with Laura's Law, this is outpatient treatment. This is mandated outpatient treatment by court order, does not force medication, but at the same time does cause a person to get into treatment who may have a potential for harm to self or others.
A mandatory treatment on that one. Now, Piedad, the county's mental health board advised the County Board of Supervisors to enact Laura's Law last year, but it was declined. How come?
There were a number of reasons, and certainly one associated with the stakeholder process. We thought that a balanced approach would be to have a participatory model of service where the participant would not be coerced or forced to treatment. The cost associated with it in terms of the service, the court services, the probation services, PD services, all of that cost was also taken into consideration, and of course the whole area of the civil liberties and the due process for individuals.
Let's talk about the pilot program that San Diego is trying out instead. What is the name of it, and in a nutshell, what does it do?
It's called the In-Home Outreach Team, or the IHOT program. And basically what the program is about is a team of peer specialists and family coaches and case managers going to the home of the individual, and the intent is to engage that individual into services. And by frequent visits and working with the family and working with the participant, assess what the needs are in terms of their mental health or other needs, and link them to services in the community.
And that's a voluntary service right
Correct.
now, about 127 people in that?
Actually, there's close to about 300 clients or participants have been referred. 127 have been outreach and engaged into the program.
Okay, Dr. Plopper, what legal rights, this is a voluntary program here in San Diego, what legal rights do adults and children have when it comes to mandatory medical treatment, involuntary medical treatment, and or taking medication?
Well, specifically psychiatric treatment, people have the right to refuse medication, have the right to refuse hospitalization unless they meet criteria under the LPS Act of being an immediate danger to self, others, or are gravely disabled. So they can be admitted to a hospital for 72 hours, then can be placed on a 14-day hold beyond that, and then sometimes, if they're gravely disabled, that is, unable to provide food, clothing, and shelter for themselves, may meet criteria for conservatorship. People can't refuse that at that point. If they make these criteria, conservatorship has been applied for, and then Superior Court judge has determined that a conservatorship should be enacted.
What programs, first of all, do you think this in-home or IHOT program here is helpful, and I'll finish this question with, or other programs here in sort of preventing this sort of violent act that we just saw on Friday and the many others that we'd seen in the last few months. Do we have programs in place, or what would you like to see in place?
Well, I would like to see Laura's Law enacted in this county because I believe we are missing certain persons who have serious mental illness, have no insight into their illness, and are refusing treatment and could represent a danger to themselves or other people. The IHOT program is an excellent program. It fulfills a need in the community, but I don't think it gets to those people who perhaps most need the treatment and are most likely to refuse treatment.
Okay, and Piedad, last question here. What should someone who's watching this at home do if they suspect that either their family member or friend is a danger to themselves or a danger to others? What can they do here in San Diego?
I think when the danger is imminent, they certainly can call 911 and they will connect to the psychiatric emergency response team or the PERT team that will go into the home and assess the situation and evaluate the individual for hospitalization.
Which is a police officer and a psychiatric
Correct.
expert. Well, we are out of time. Thank you both for talking with us. Now, anybody in San Diego can reach County Mental Health Services 24 hours a day, 7 days a week by calling toll-free the number on your screen. That's 888-724-7240. That's 888-724-7240. Or they can go to our website for more services, kpbs.org.